Good afternoon. This is Constance Thurman here. I am going to try to record today's lecture for you. I'll play it during class, but I'll also try to get it uploaded on the website on Blackboard. So if you're unable to attend class today, or if you were unable, then you can still have access to the lecture itself. So today's chapters will be over the surgery, the integumentary, and the musculoskeletal systems. Integumentary honestly has got to be probably one of my top 3 favorite sections. Part of that's probably because I coded for a dermatologist and Mohs surgeon up in Northwest Arkansas, so that was really neat, and I got to learn a lot of different things through that. So it kind of helped me clarify the integumentary system a little bit better as far as coding goes. So anyways, let's get started. So the chapter arrangement for these sections, if you understand the arrangement, it makes your coding assignment a whole lot easier. So basically that means if you understand how the book is laid out, if you understand how to locate your codes or your sections a little bit better, that helps you be not only a faster coder, but a better coder. More than anything, though, I think knowing and understanding your book helps you better on your coding certification exams if you choose to become certified in coding. So, subsections are arranged by the body system. So, anatomical site, top of the body, the head of the scalp, working all the way down towards the toes. Then you have diagnostic versus therapeutic procedures. Diagnostic means this determines the diagnosis and establishes a care plan, whereas therapeutic is used for treatment for the diagnosis. The surgical package, the CPT codes that identify a surgical procedure, may include other services that are integral parts of that surgical procedure. These are not billed separately. CPT clearly defines services that are always included, so make sure that you always read your parenthetical notes, your CPT guidelines, etc. National Correct Coding Initiative. You guys are familiar with this a little bit if you've started working on your research assignment. This standardizes proper coding and payment for Medicare Part B. Medicare Part B includes outpatient hospital services and fiscal intermediaries. Insurance claim rejections are based on coding conventions. Mutually exclusive. This is services that cannot physically be performed together during one encounter on the same anatomical site. Code pairs that by definition would not be performed at the same encounter, and modifier indicator may be noted. Unbundling and fragmenting. Unbundling. Procedures performed and services separately coded and submitted to insurance company for payment. Fragmenting is several procedures performed at one surgical encounter, rather than using one code to capture all services rendered. Denials. Repeated denials for unbundling and fragmenting are red flags to Medicare and insurance carriers. This more than likely will trigger an audit, and that could lead to fines. The fines, we're talking like in the thousands and thousands of dollars for this. So not only do you have to return money that was possibly paid on these claims, but your facility could also have to pay additional fines. So I don't know about you guys, but that cuts into my revenue. That cuts into my paycheck because, if they're paying fines because they're not doing things correctly, then that means I'm not getting that possible Christmas bonus or yearly cost of living raise or anything like that. So I'm all for doing things the right way. So the integumentary system, this is your skin. It acts as a shield. It's considered the largest body system. It protects deeper tissue. It retains fluid, helps regulate the body temperature, and contains layers. Here we have a little sample diagram of the integumentary system. I've listed some abbreviations here on this slide. I'm not going to go through them, but this PowerPoint is available on Blackboard for week 2 if you want to print it off or save it to your computer and take a look at it later for future references. Your layers of skin. You have your epidermis. This is your outermost layer. There's no blood vessels or connective tissue. Then your dermis, a thick layer of tissue located directly below the epidermis, more sensitive and self-sufficient. Subcutaneous layer makes connection to muscle surface. Documentation of measurements. Measurements of area treated needs to be reported. Elements in note are important for proper code selection. It's necessary to measure in centimeters. For example, 1 inch equals 2.54 centimeters. I don't remember, but it's quite possible that there's something about this on one of your assignments this week. It's been a little bit since I've made those, so I could be wrong, but just a little note just in case. Never assign the code based strictly on what the provider says happened. Remember, guys, if you've had any of Miss Brenda Huntsinger's classes, she is very good about drumming in your heads. If it's not documented, it didn't happen. Coding is no different. If it's not documented, it didn't happen. That means if the provider says he done something and it's not documented, you can't code for that. You can get in just as much trouble as the facility themselves or the doctor themselves. I really don't want to be reading about you in the news. Aspiration and imaging guidance. Aspiration is fluid surgically removed from the body. Fine needle aspiration. A very fine needle is inserted into the site to draw fluid. Imaging guidance may or may not be used. Imaging guidance, radiological procedure that assists physician in locating the area to be addressed. Incision and drainage, often called IND. These codes are generally found between the 1040 to 10,180 code range. Surgical cutting over area to be drained, then withdrawing fluid or draining. A type of abscess or cyst, and it could be simple or complicated. Debridement. This is a type of cleansing. Necrotic or damaged tissue debridement must be documented to support medical necessity of extensive debridement. The plus sign indicates that a code is an add-on. This needs to be used in conjunction with another code. So an add-on means that you will have at least 2 codes. Note the instruments used to perform the procedure. Your biopsy codes. 11100 and 11101. Sampling of tissue removed for pathological examination. Used for skin, subcutaneous tissue, and mucous membrane. Not assigned if more involved procedure is performed. Skin tags 11200 and 11201. These are growths found on many areas of the body. Removal is usually done with scissors, scalpel, or ligature strangulation. 11200 is for the first 15 skin tags, and 11201 is for each additional skin tag over 15. This is an add-on code and is not to be used alone. I do want to reference that a majority of your insurance plans will not cover skin tag removal. The reason being is because this is considered to most plans as a cosmetic procedure. Very, very seldom have I seen this get paid by insurance. Usually those are when they're really, really irritated, they're in a problematic location, causing a lot of trouble for the patient themselves. I'm not sure if you've heard this in other classes or not, but it has to be proven medically necessary for the procedure in order for insurance to pay for it. Just because you think it's medically necessary, just because your doctor thinks it's medically necessary, does not mean that the insurance payer thinks it's medically necessary. And at the end of the day, they have final say no matter what we do. Granted, we can try to appeal, but most of the time, it does not work when it comes to skin tags. Shaving a lesion, 11300 to 11313. This is removal of a lesion from epidermal or dermal layer without incision or involvement of a subcutaneous level of skin. This is a horizontal movement, and the anatomical site and size of lesion is very important to know when coding this. Types of lesions. This is important to know as well. Benign. Benign lesions are cell growth abnormal but not life-threatening. This means they are not cancerous. Benign excision of benign lesion is 11400 to 11471. A malignant lesion is an abnormal cell growth, but it is cancerous, so this is bad. I've heard this referred to as um, bad lesions, good lesions. In reality, it's all bad, but one's a little bit worse than the other. The excision of the malignant lesions 11600 to 11646. Then we have routine foot care 11719 to 11721. Systemic diseases make a difference, for example, diabetes, peripheral vascular disease, etc. Class findings reflected with the use of Q modifiers. Here's a image of your nail. Nails are 11730 to 11732, the avulsion of a nail plate. 11750 to 11752, nail and nail matrix excised. So if you ever have like an ingrown nail or something like that, you might be in this area if you're coding your own chart, just for curiosity purposes. I remember a time I had to miss coding class. My mom was getting a lens transplant up in Fayetteville, so I had to miss class, and Miss Scherer had me code her report for class credit for that day. So it was kind of exciting. I was a little surprised when she gave me that assignment, but when it was done and I handed it in, turned it, put it on her desk, I really learned something. So just FYI, that might be a future assignment for somebody, maybe in this class or another one. So the repair, surgical closure of an area. This can be simple, intermediate, or complex. Simple, this is a single layer closure. The laceration does not go deeper than the subcutaneous tissue. Intermediate, this is a layered closure. Laceration does not go deeper than non-muscle fascia. Complex, this involves reconstruction, skin grafting, stents, retention sutures, or time-consuming techniques. Wounds. Clean, very low infection rate, 1 to 5%. Clean, contaminated, low infection rate, 8 to 11%. Contaminated, major break in surgical techniques. Acute non-purulent inflammation is present. A dirty or infected wound is non-sterile conditions. Infection and inflammation is present. Adjacent tissue transfer or rearrangement. Adjacent tissue transfer, this is healthy tissue manipulated or rearranged from site closed to or next to open area. This is often due to a disease or injury. A pedicle flap, this is a flap of skin that hangs on the stem of skin that contains a blood vessel. Surgical preparation. Defective recipient site, this is an area that will receive a graft. And a donor site, this is the area that provides the tissue used to make the repair. So think of like if you're donating clothes or food, you're the donor. So if you are donating, like say half a kidney, then you're the donor. You're the donor site. Your kidney is the donor site. The defective recipient site would be whoever you're giving your kidney to, or whoever you're giving your clothes or food or whatnot to, for this example. So check if the repair of the donor site is included in the code selection. Sometimes it is, sometimes it isn't. Lesion excision not reported separately if adjacent tissue transfer or rearrangement is performed at the same site. Grafts. This is a section of tissue moved from one site to another in an effort to heal or repair a defect. So for example, I'm going to use a Mohs surgery example. The patient came in with a skin cancer on his nose, and they took a piece of skin after they cut out the skin cancer. They took a piece of skin from under his arm, kind of like the little flabby area. They took a piece of skin. It was the only thing that really had the same skin tone because he liked to work outside a lot. Anyway, so They took a piece of skin from that area and they put it on his nose, so that's classified as a graft. They moved tissue from one side to another. Some types of grafts are homograft, homologous, autologous, heterodermic, free, split skin, or split thickness. Most of my experience is with the split thickness grafts, but none of them are really all that hard to code. So, selecting a graft code properly, you must know your location of the defect, the size of the defect in centimeters, remember, type of graft, the procedure note, and any other pertinent information. Flap grafts, several types, pedicle, tube, delayed, or direct. Determine if the graft was reported by recipient or donor site. A pressure ulcer. These are common in elderly patients. Um, Anybody really could get them, but they're common in elderly patients, mainly because they don't get up and move around in a whole lot. So pressure ulcers are located 15920 to 15999. These are erosions of the skin. The tissue becomes inflamed and then lost. Limited circulation causes breakdown. A decubitus ulcer is a result of a continuous pressure in the area that eventually limits or stops oxygen flow to the area. So think about an elderly patient in a nursing home. They're laying in bed all the time. And they have to be generally, a general standard rule is that patients are to be turned every 2 hours. So they go from left to right to flat, and they keep rotating every 2 hours. That is mainly to prevent pressure ulcers. So if you think about it, if you've been sitting in one spot for so long, like eventually the circulation starts getting cut off in like your leg, for example, depending upon the type of chair you're sitting in. Well, it's no different for these patients. They can't get up and move, so circulation is lost. It's very limited. So blood flow is not going through, your oxygen's not going through, and so eventually that skin starts breaking down, and it causes can be a pretty bad sore. So we just try to prevent that. But if you ever have to code one, it's make sure that you have the size more than anything. Make sure you have the size in centimeters. Burns, 16000 to 16036. This is injury to body tissue as a result of heat, flame, sun, chemical radiation, or electricity. Remember the rules of nines and the degree of burn. You have to know the degree. So, if I recall, and I could be wrong on this, I don't have my coding book in front of me, but if I recall, I had you guys tab the table of burns. So if you didn't, make sure that you do, and if you did, or if you haven't and you do, make sure that you review over that so you kind of have a general idea of what that area is. Destruction, 1700 to 17286. Procedure that totally destroys or removes something. Cryosurgery, laser electrosurgery, surgical keratoment, or chemosurgery. The code description needs to be checked carefully before the code assignment is completed. Mohs micrographic surgery, this is one of my favorites. 17311, 17315. This is a type of chemosurgery, chemical fixative placed on lesion before removal. The surgeon acts as a pathologist after the lesion removal. So all of the surgery and the pathology section of this procedure is all done in-house. This is not sent out to be reviewed. There's no waiting. Oftentimes the patient comes in that morning, they take out a layer or a stage, and then the doctor will have that reviewed, as he'll be the pathologist, so he'll have it reviewed in the lab. And then if he's got it all, the patient goes home. If he doesn't have it all, the patient goes back to surgery before the end of the day. So in order for this to be considered a Mohs surgery, the surgeon must act in both capacities in order to build this code range. So they have to be a pathologist and a surgeon. Okay? So if your doctor does the surgery and then sends the patient home, tells them to come back in a few days, and they ship off the sample to another lab, another pathologist, and you wait 2 or 3 days for a result. This is not a Mohs surgery, okay? Breast procedures 19000 to 19499, a mastotomy, surgical incision of the breast, a mastectomy, excision of the breast or breast tissue, biopsy codes with or without imaging guidance. Class findings and modifiers. Class A, non-traumatic amputation of foot or integral skeletal portion thereof, Q7. And Class B, absent prior tibial pulse, absent dorsalis pedis pulse, or evidence of advanced tropic changes, Q8. So in summary, the surgical package includes pre-op, procedure, and post-op care. NCCI edits need to be referenced. Procedures can be diagnostic or therapeutic. There are 3 layers of skin. Measurements of the area treated needs to be recorded for code selection. Keep in mind, needs to be coded in centimeters, or measured in centimeters, sorry. Codes are differentiated according to type of procedure, such as I&D, debridement, excision, repair, etc. And read the descriptions to determine the basis for code selection, the size of lesions, number of lesions, etc. So coding practice. Select a code for intermediate repair of 8.4 centimeter laceration of scalp. I'll give you guys a few moments, see if you can figure out the code. Okay, if you got 12034, your answer is correct. Select a code for puncture aspiration of cyst of breast. Here again, I'll give you guys a few moments to see if you can locate the code. I think I'm going to have to start bringing candy for whoever gets the code correct. Something fun anyways. Okay, if you got 19000, your answer is correct. Musculoskeletal system. Let's take a few moments break and we'll come back and finish up lecture. Okay, so the musculoskeletal system. This is the 20,000s to 29999, a bunch of nines. This includes bones, muscles, tendons, cartilage, and soft tissue. The organization for this section is head to toe, the type of procedure, and understanding of anatomy and terms. Here's a sample of a human skeleton, lateral view. I'm sure you guys remember an image like this, or similar to this, from your anatomy classes. I know if you had Miss Pope, you've had lots and lots of labeling and pictures to help you remember the different anatomy areas. Here's the interior view of the skeleton. The posterior view. So terminology. Surgical terms need to be understood to properly locate the code needed to report the service rendered. Some common terms are arthroscopy, debridement, fixation, and manipulation. If you guys recall back to the first day of class, I told you that I highly recommended that you get a medical dictionary if you did not already have one. Again, this is not a requirement, but it is highly recommended. And just like before, here's some abbreviations. I'm not going to go over these, but they are in the PowerPoint on Blackboard for you to review. Incision and drainage of soft tissue, 20005. Incision and drainage of soft tissue abscess. Subfascial involves the soft tissue below the deep fascia. Traumatic wound exploration, 20100 to 20103. Wounds follow traumatic injury. Wound exploration determines the extent of the injury. Debridement, removal of foreign material, coagulation or ligation of minor subcutaneous and or muscular blood vessels, subcutaneous tissue and or muscle fascia muscle. A biopsy. You must determine the site of the biopsy or the excision, whether the biopsy was superficial or deep, whether the percutaneous needle was used, and whether the procedure was completed as an open procedure. Sorry, that slide was on there twice. Introduction or removal, 20500 to 20697. Aspiration and injection procedures. Halo devices, pins, external fixation systems, and wires. Imaging guidance and notations need to be read and followed. Replantation, 20802, 20838. Replantation following amputation, differentiated by site, lengthy surgical procedure, repair of soft tissue, tendons, bone approximation, and blood vessels. Grafts or implants, these are separate from the integumentary system, 20900 to 20938. Cartilage, bone, fascia lata tendon, and tissue grafts do not assign modifier 62, and codes 20930 to 20938 report spinal bone grafts. The anatomical subsections within the musculoskeletal section. These are organized by type of procedure, such as incision, excision, introduction or removal, repair, revision, and or reconstruction, fracture and or dislocation, and other procedures. Incisions. The reasons can be exploration for diagnostic purposes, drainage of abscess with or without bone removal, drainage of a hematoma with or without bone removal, removal of calcareous deposits, and removal of foreign bodies. Excision. Surgically remove a structure, codes differentiated by anatomical site, structure excise, partial versus complete excision, accompanying procedures, and reference the term excision or medical name of procedure to locate the code in the in the CPT manual. Common excisional procedures. Fasciectomy, removal of fascia. Osteectomy, the removal of bone. Synoviolectomy, removal of synovial membrane of joint. And cartilage, the process of removing tissue by scraping. I'm probably pretty sure I jacked up some of those pronunciations, and for that I apologize, but I hope you get the point that I was trying to make or understood the words I was trying to say. I hope. Anyways, if not, I apologize. Introduction and removal. Types of procedures. Removal of foreign bodies. Injection procedures for radiological procedures. Application of fixation devices. Impression and custom preparation of prosthesis. And removal of implant or prosthesis. Repair, revision, and reconstruction. This is differentiated by the site, the type of procedure, and the accompanying procedures. Terms referenced is reconstruction, then anatomical site, repair, then anatomical site, and specific name of the muscle, tendon, joint, or anatomical site. Here is a image of a hip and knee replacement. Fracture dislocation. You must determine the location of the fracture, whether the manipulation was performed, whether treatment was open or closed, any skeletal fixation, and whether fixation was internal or external. The application or removal of the initial cast or strap is included in the CPT code. Manipulation. Attempt to realign the bone or joint. Closed reduction is manually applying force to the injured area. I don't know about you, but this kind of puts me in the mind of Grey's Anatomy and when Callie was on there. Open reduction. Surgically open to realign area. External fixation. Pins through the soft tissue. And internal fixation. Pins placed internally. Here's a visual for a closed reduction. Cast and strapping, 29000 to 29799. Immobilize the area. Splint application includes the static splint, prohibits mobility, and the dynamic splint allows limited mobility. Cast removals or repairs, 29700 to 29750. Only used when cast removal is performed by the individual who is different from the individual who applied the cast. Differentiated between removals, repairs, wedging of cast, and the type of cast applied. Endoscopy or arthroscopy, 29800 to 29999. Endoscope, optic illuminated instrument used for visualization of internal body organ or cavity. Arthroscope, instrument used for visualization of interior of joint. Procedures can be diagnostic or surgical. Surgical endoscopy, arthroscopy always includes diagnostic endoscopy, arthroscopy. When arthroscopy is performed in conjunction with arthrotomy, add modifier 51. So a little summary. Wound exploration determines the extent of injury and includes surgical exploration of the wound. Imaging guidance can occur with many of the procedures in the musculoskeletal system. Internal and external fixation needs to be identified. Arthroscope is used to visualize the interior of a joint. Diagnostic scopes are included in therapeutic scopes. Replantation involves repair of soft tissue, tendons, bones, approximation, and blood vessel repairs. Sorry, it's been a long day. And some coding practice. Select the correct code for an arthroscopy of knee for lavage and drainage. I'll give you guys a few moments to locate the correct code. Alright, if you chose 29871, you are correct. Select the application of a long arm splint, shoulder to hand. Again, I'll give you guys a few moments to find the correct code. If you chose 29105, you are correct. And that is it.